Hello and welcome to the last Monday morning message for our class for Introduction to Administrative Medical Careers. Um, After this one, you will have a final exam and we will close this thing out. So today is chapter 17 and it's marketing the medical office. And what I think is kind of fascinating about this is I'm all about marketing things, especially in the realm of education. When you have certain programs like ours that are career technical programs, things that are designed to get people to work sooner than later. One of the things that I'm very passionate about is marketing my program, marketing programs that promote this idea of building or starting a career. And unless people realize that that program exists, it's very hard sometimes to increase enrollments or to maintain certain enrollments. In a doctor's office, a little bit different. The majority of providers don't market in traditional ways. So if you think about it, when's the last time you saw your family doctor marketing their office on television or on the radio? It usually doesn't happen. Now we see hospital groups do it, right? We see, the Kaisers of the world do that. We see different hospital groups like Centura or St. Jude's. They typically advertise on television, but smaller practices, in particular private practices, typically don't. So I'll give you a good story of an office that I worked in Centennial, Colorado. The office had opened in 1992, and it had one doctor and one office manager who served as the office manager, the medical assistant, the referral person. She had filled all of those roles starting in 1992, and the doctor opened up his own private practice, which doesn't happen very often anymore either, where a doctor opens their own practice. Usually, most doctors are joining groups now, but he had opened his office, and basically he had no patients. He did no advertising. He opened it in a medical plaza that had other different providers and specialists in it, including an emergency room. And he said, kind of like if you go back to the film Field of Dreams, if you remember that, and Ray Kinsella, he said he had the voice in his head that kept saying, "If you build it, he will come." Well, this doctor took that same approach and said, "Look, if I open this up, eventually people will show up." And one of the ways to promote the practice was that he was providing a different type of service, a more personal service, a more hands-on approach, and a more kind of intuitive, interactive doctor-patient relationship. And so he opened the doors with nobody, no patients. And when the first patient walked in, he provided this different level of care, and eventually word of mouth spread. And that person told family members and friends, and the next thing people start showing up as new patients. That's typically how it happens in particular for smaller practices. But in our PowerPoint, we start talking about things. One of the things that I like in the key terms, it talks about return on investment. We take that one very seriously. A return on investment basically means that we have to take a look at how much something is going to cost. In particular, in this presentation, we're talking about marketing a practice, right? So if I had to hire maybe a marketing firm, somebody with some professional knowledge that could market my program or my office for me, I have to look at how much that costs, and then what is the return on that investment? How quickly will I realize patients and potential profitability for me? So if it doesn't make sense, if it doesn't make financial sense to go this route, then we wouldn't do that. In particular, we look at return on investment for equipment. In practices that I've worked in, whenever we're considering buying a new piece of equipment, we usually look at what is the cost of the equipment and what is the reimbursement for that particular procedure that we'd use the equipment for, and how quickly how many patients would it take to perform this procedure and get our money back? If it makes sense and we're going to receive our money back fairly shortly, then we might proceed with that. If it's going to be something where I'm going to expend, thousands of dollars on a piece of equipment and it's going to be 3 or 4 years down the road before I actually realize a cost benefit from that, then I may need to decide, I'm going to have to decide whether I want to do this or not. Okay. So we're always looking at, the perspective view. We're kind of looking at the ROI, the return on investment. What does it look like if I project out into the future? Is it going to be financially prudent for me to potentially do something here? Okay. Determining a target audience, that's important. That's typically revolves around what type of specialty that I am. And one of the things that I would go back to is looking at family practice. I come from a family practice background, and in family practice, that's still a specialty. General practice is still a specialty, but healthcare and medicine is so specialized and compartmentalized now that determining your target audience, obviously, if you're a family practitioner, your target audience is the population as a whole, to provide a kind of what would we call it, a potential gatekeeper for your healthcare, right? That's usually your primary care physician, somebody that coordinates your care down the road. So the target audience there is fairly broad. When we're talking about another specialty like nephrology, and it's just a kidney doctor, right, a kidney specialist, then their target audience is typically people with kidney disease, okay, or some dysfunction with the kidneys. So determining that and really looking at that population is important. Other things that we could look at, I kind of like slide 10 where it talks about the internet as an advertising tool. Obviously now with social media, everybody, including doctors, are using social media to get the word out about their services. I know several offices that do things with, Instagram and Facebook and whatever other platforms are out there. They're using those to potentially target people. We see that in a lot of different industries, but in particular healthcare. Yeah, I will say this honestly, I think it's usually a little slow in responding to things like this. We're starting to really see that more. Twitter is a big one for healthcare and for human service type things. So that's I'm a big proponent of using technology as much as possible. It's one of the reasons why I do this. For most of you guys, I don't get to see you as students face to face. Some students I do. Some of you that are watching this, I actually see a couple times a week here on campus. But this is a wonderful way for me to be able to put my face in front of you and try to interact in some way. We do that with things like discussion groups in classes. I don't do a discussion group with you guys. I'm considering doing that in the future, but discussion groups are another good way of using a platform to communicate with each other. So from a marketing perspective, using things like social media, Twitter, Instagram, Facebook, we're starting to see that much more now, okay? Creating a website, another good one. People oftentimes will search for providers via the internet. They will communicate with their practitioner sometimes via their website. That's another one that's kind of a sticky one. I remember working in a practice where one of the questions from patients was, "Can I just email the doctor?" Well, that's kind of a catch-22 in a way. For a busy practice, email can be challenging because doctors get paid for seeing patients in the office. They don't get paid, we don't get reimbursed for things like answering emails. So emailing your provider oftentimes is usually a one-way communication, right? So if anybody's familiar with Kaiser, I mean, a lot of times we'll get those messages via Kaiser's um, their app, and oftentimes those messages are one-way messages, meaning that the provider is sending you a message about what they've done or what your test results are, but usually you can't respond to that stuff, or they set it up so that you can respond and reply one time, but if you have additional questions you need to come into the office. Well, part of that in particular for like a smaller private practice is that we don't get paid unless you come in, and oftentimes it's hard to it's very challenging to make a diagnosis unless we can actually touch the patient, if we can look at the patient, if we can do evaluations on site with the patient. So having some contact through a website is good for some of the demographic type of things like insurance, new patient paperwork, that type of stuff. But from a diagnostic standpoint, it doesn't always translate very well. Some offices are much better than others. Some have kind of figured out how to do this for patients. But I know in my last office, we had considered setting up email with our doctors, and we had ultimately decided that that wasn't a good idea because we felt like we were going to have to hire somebody just to answer emails all day long, because of the number of we had several tens of thousands of patients in our practice, and we thought we could get thousands of emails a week. How is the doctor going to sit down and answer all of those emails, or who's going to do it? Is it going to be a nurse? Is it going to be the MA? Is it going to be the office manager? But the doctor doesn't get paid, and the rest of us get paid because the doctor sees patients. That's how we get paid. So we decided not to do that. But we were also very open to returning phone calls. When patients would call us, that was kind of how we dealt with it. Was we'd always been very good about getting messages to the providers, and then in the provider's time during the day, in between patients or at the end of the day, they would return those phone calls. We were pretty good about that, so we decided we were going to keep running with that model. Um, but websites are good for introduction purposes or for disseminating certain information about the practice. The new patient paperwork possibly being downloadable or being able to upload and send that to the practice ahead of time. Those things definitely work pretty well for most of us. Direct mail advertising, we don't do a lot of, from a small practice perspective, but you do see that from larger corporations, from managed care corporations. I just received a mailing from a healthcare outfit just this week that I didn't know about, and they sent some information in the mail, and I thought, okay, this is interesting. It was a fairly new clinic in the area, and they were trying to get the word out that they were actually here. So I actually kept it, for selfish reasons, not for my healthcare reasons, but for potential students, and maybe building a relationship with that company for doing internships for our students that participate in medical internships here on campus. So I may not have known about them or sooner than later if I hadn't gotten that mailing. So that was actually good. Um, Other things, we get into the welcome to the neighborhood programs. Low cost screenings or free screenings is probably a good way to actually get your name out there to participate in certain community events, doing free blood pressure screenings at health fairs, that type of thing. That's a wonderful way and a very inexpensive way to get your name out there. I've done that many times with colleges that I've taught at, where I've taken my students out and done blood pressure readings at health fairs to let people know that we had programs at the local college for healthcare careers. So same thing applies for doctors' offices. It's cheap, it's easy, usually only encompasses a few hours, in a day or a weekend to go out there and kind of promote what you do. So I think that's wonderful. Let's see. as far as anything else on here, educational speaking engagements is probably another good one. You'll find doctors in certain specialties will do this more frequently. If there were, again, health fairs are wonderful for this to possibly have a doctor do some kind of a training or something on what they do, like maybe a diabetes education class, like a free one. That's a good way to educate patients that, hey, we manage diabetes in our practice. You should come and see us. Okay. We don't do a lot of things. This one's actually pretty good. It says using telephone books. You know, a wide variety of my students are actually much younger now and haven't really seen a telephone book or know what a telephone book even is. We used to do a fair amount of advertising that way, but we don't do that type of print advertising much anymore. I know the majority of us now, typically when we get a telephone book, a paper telephone book, a lot of us, and I'm guilty of it, I put it in my recycle bin because usually I can use the internet to find the things that I want to find. So that one's not used quite as often anymore as it used to be. Um, Patient surveys are good. A lot of times we'll get some useful information about our practices. So this may be even post-marketing efforts is doing patient surveys for patients that have already come to see us and kind of find out, did they enjoy the service? Did they like it? Are there things that they wish that we were doing? Are there suggestions that we get from patients? And we'll take those pretty seriously. All right. So I kind of think that's about it to cover this one. You will, of course, have a little exam on this chapter, and then after that, your final exam. So I'm super excited that you guys made it this far through the semester with me. I wish you all the best of luck in the future. Don't forget, you can always reach out to me anytime you want to with questions, concerns, comments. If you need any advice, future stuff, if you're looking at certain programs to take or classes to take here at Miracosta or elsewhere, I'm certainly happy to try to give you some guidance on that one. So don't feel like you can't reach out to me even after you finish this class. So again, thank you so much for being my student. I really do appreciate it. I'm super excited to maybe hear about what you might do in the future as well. Let me know if there's anything I can help you with. So thank you very much, guys, and I will see you later.